How many of you believe that our nation's military members are real-life heroes? Just by a show of hands. Looks like the majority of the audience. I'm not actually surprised by that. That's actually what I expected. And I gotta tell you, I completely agree with you. And it's because I agree with you, and it's because I see these men and women as heroes, that I decided to join the United States Air Force as a medic in order to provide health care for these awesome individuals. And when I was in training, all of my peers and I were very strongly encouraged to donate blood. We were told about how great a commodity blood was and how we would really be making a difference by choosing to step up to the plate and by choosing to donate. We were told that this would be our very first opportunity of many to be real-life heroes. So imagine my disappointment when I didn't even qualify. I wasn't disqualified because I had recently traveled to a developing country, and I wasn't disqualified because I had recently gotten a tattoo or a piercing. I was disqualified simply because I belonged to a particular demographic of people. I was disqualified simply because I'm gay. Isn't that appalling? That in the year 2015, gay men have the right to get married, and we even have the right to serve openly in the United States military. But what we can't do is donate blood. Now, some people might wonder, well, what's the big deal? Why does it even matter if gay men can donate blood or not? And my answer to you would be that according to the American Red Cross, currently only 38% of the United States population is even eligible to donate blood. And of that 38%, only 10% of those people do. Now let's couple that with the fact that between 41 and 71% of the United States population will need a blood transfusion at some point in their lifetime, according to the University of North Carolina. We've got a pretty big problem on our hands. We don't need to be expert mathematicians to understand that there's a significant deficit there. There's a heavy demand for blood and blood products, and gay men can help with that. Now, the reason that gay men are currently banned from donating blood is because we're perceived to have an increased risk of contracting viruses like hepatitis B and HIV. The FDA states that there is no indication that there could be any subgroup of gay men who are less likely to contract these viruses. The problem with this is that we seem to be operating under the assumption that the risk of these viruses is inherent and that there's nothing that could be done about them. We know that both of these viruses are preventable. In fact, hepatitis B is completely preventable, as vaccines are currently available, and they have been since the 1980s. And with the introduction of new prevention methods such as pre-exposure prophylaxis, HIV is soon to follow suit. Now, for those of you who may be unfamiliar with pre-exposure prophylaxis, or PrEP as it's often called, it's a relatively new form of HIV prevention whereby individuals who are determined to have high risk factors are given the HIV medications in order to prevent the transmission of the disease. And it's 92% effective. I think it's also important to note that all donated blood is very thoroughly tested. Our technology has improved significantly since the dawn of the HIV crisis. And today's test can detect the presence of HIV just 2 to 4 weeks after a potential exposure. It's also important to note that there are other demographics who have particularly high rates of these viruses, but that hasn't resulted in their disqualification from donating. So, for example, African American women, they also have particularly high rates of contracting HIV. And one could argue that individuals who are at a lower socioeconomic status are more likely to contract hepatitis B because they don't have access to those vaccinations. So, should we then be considering banning blood donation for African American women or for individuals who don't meet a certain income? No, what we have here is a discrepancy between perception and reality. The reality is that we all have the same risk factors. regardless of our demographic. Those risk factors are universal. And our solution here is to change our pre-donation surveys in order to identify those universal risk factors. So instead of asking whether or not someone is gay, we should be asking more relevant questions like, are you even sexually active? And if you are, do you use protection? Are you in a mutually monogamous relationship? And when was the last time you were tested for an STI? All of these are much more relevant questions and much better screening tools for determining a person's risk factors than asking if someone is gay. But believe it or not, I'm not the only person who thinks this way. Even the American Medical Association has been rallying to repeal this ban for years, citing that it's not even based in sound scientific evidence. In fact, there are plenty of organizations who've been trying to get this ban repealed since the year 2006. So how do we do it? How do we finally change this policy? The first step to solving any social issue is to first raise awareness about it. Because after all, you can't really change something if you're not aware of what's going on, right? And I can't tell you how many people I've encountered on the road to this presentation who had no idea that this was even an issue. They simply didn't know. I also think that a lot of people don't realize that blood donation is a business. Yes, you may donate blood, but blood definitely is not donated to patients who are in need. It's sold at very profitable prices, mind you. And the current stigma surrounding gay men and our blood makes our blood less valuable and thereby less profitable to those in the business of selling blood. So the solution to solving this problem, in order to change this policy, it starts with changing the public's perception. That's why I'm hoping that this conversation doesn't just end here in this room today. What I'm asking you to do is to keep the conversation going. Embrace the opportunity to challenge your own perceptions and the perceptions of others, because doing that will undoubtedly destroy this current stigma. So, the person to your left, and the person to your right, imagine that you and them, all three of you, are in a life-threatening condition and in dire need of blood products. You know what it would take to save all three of you? Just 1 pint of blood. 1 pint of blood from one donation from just one person. Just one person has the potential to save all 3 lives. Just imagine how many lives we could save by destroying this policy. If you yourself needed a blood transfusion, I would imagine that most of you would accept it without particular regard to who it came from or what they believed in or what their background was. As long as it was adequately tested and deemed to be safe, I'm sure that most of you would accept it. So, you know, on the FDA's website, it states that in order for this policy to change, we would first need to understand what it is that motivates gay men to want to donate blood in the first place. I'd like to answer that. Now, I can't speak on behalf of all gay men, but what I've learned through my military service is that your brother in arms is your brother, and your sister in arms is your sister. It doesn't matter what their background is or what they believe in. Their sacrifice is just as valuable as your own. And with that being said, if somebody is willing to sacrifice a part of themselves, a part of their own life for your well-being, whether it be through blood donation or through military service, that's something that should be respected, and that's something that should be valued.